how are payers and providers integrated into this whole aspect of ACOs and the aspects around dashboards and quality and metrics and best practices?
Well, thanks, Maria. I think, as you know, Sandra and Joe know as well, is that healthcare is local. And when healthcare is local, we just have to understand the challenges that every urban community at least faces, because you have different provider groups, different payers, and the concentration of those payers and provider groups are very different, just as we've heard from Sandra and Joe and what they're doing in Pennsylvania or New Jersey, or you're doing in New York or around the country, as you mentioned, is what we do in Colorado. And we have a different payer component, and we have different self-funded employers that in different markets. And the way we've defined it is that, how do we create what I call market relevant value for the payers and employers with a provider community that's engaged, that has analytics, that has decision support tools that can help physicians deliver what I call better, safer, coordinated care. And so trying to get that payer community to understand our 10-year clinical integration journey and document our performance improvement in quality and cost, the triple aim things we all talk about, is sometimes very challenging. I think that Sandra could comment, and certainly she should comment after me, is that when you have your own health plan, which she does, then they have both the what I call clinical data and claims data to really focus on areas, because they can see how their quality efforts or performance improvement quality affects their claims. And then you can concentrate on those areas. So I believe it's a journey, and just as Joe's doing with his innovation strategy with different organizations and ACOs, he has to understand exactly what they're trying to create, what they're trying to do, what kind of value they're creating in their own communities, and how that translates to the employers. Every employer I at least chat with of late says, how can you help me have a healthier workforce, and how can you help me take the cost out of the system, where the cost now is becoming that absolute focus of issue, because we just have a cost issue in this country that everybody's trying to grapple with.